There are 7.5 billion people in the world, each one of them fighting their own battles. This man is about to reject the job offer he has always wanted because it requires traveling, and due to his fear of flying, he will miss out on his dream job. This woman is trying to figure out how to tell her kids they can't adopt a dog because of her fear of dogs. And this college student, he just dropped the class he needed to graduate to avoid being on the second floor because of his fear of heights. These are all examples of specific phobias that people across the globe deal with every hour, every minute of every single day. Specific phobias affect people of all races, genders, and ages. These phobias are triggered by specific objects or situations and result in extremely high anxiety and fear. The anticipation of these events or objects and media representation will lead to the same extreme fear and anxiety. The DSM-5 went over the main criteria for specific phobias. It all starts when there is a marked fear or anxiety about a specific object or situation, which then always provokes immediate fear or anxiety. People that suffer from these phobias will go out of their way to actively avoid such scenarios or objects. The fear and anxiety felt is not in proportion to the actual fear or situation invoked. The DSM-5 also classifies the 5 subtypes of specific phobias as animals, such as snakes, spiders, dogs, insects, birds, natural environments like storms, heights, and water, blood injection injury, seeing blood, witnessing an injury, receiving an injection, and seeing a person in a wheelchair. Situational factors such as public transportation, tunnels, bridges, elevators, flying, driving, and other types of phobias such as choking, vomiting, and space phobias, which is a fear of falling down if not surrounded by walls. Specific phobias can be treated. Some treatment methods include exposure therapy and virtual reality treatment. Exposure therapy is when there is monitored exposure to the object or situation that is feared. Individuals will be exposed to the situations and objects that elicit fear, and gradually their fear begins to disappear. However, in this video, we will be focusing on virtual reality as a treatment for specific phobias. Now, what exactly is virtual reality? You've probably seen it at the mall, in the media, in video games, but what exactly does it do? Virtual reality is a computer-generated environment with objects and scenes that appear to be real and can make the users feel immersed in their environment. But how does this tie in with the treatment of specific phobias? Some therapists have started to use virtual reality to simulate certain phobic events. If this form of treatment is successful, there would be no further need to place people in real-life situations to relieve them of their phobias. One thing that virtual reality provides that exposure therapy doesn't is that with virtual reality, you can repeat the same scenarios multiple times within one therapy session. However, with exposure therapy, it would be too costly and impractical to keep putting individuals in the same real-life situations. With virtual reality, all factors of the situation can be controlled, such as the weather, background, even turbulence on an airplane, and other factors we can't control in the real world. Another issue with exposure therapy is that there is a relatively high dropout rate, whereas more clients would rather follow through with virtual reality treatments. Recent virtual reality studies have been mainly done on individuals with a fear of heights, flying, and spiders. Most existing trials suggest that virtual reality for flight phobia results in significant and long-term reductions in cognitive, behavioral, and physiological symptomatology that are greater than those shown by non-specific control conditions and similar to those shown after exposure therapy, which is the golden standard treatment. Virtual reality treatments for spider phobias have been shown to lead to robust reductions in cognitive, behavioral, and physiological indicators of fear that are maintained over follow-up in as little as one session. The effects of these treatments are similar to that of an exposure therapy as well. While sample sizes have been small, studies do suggest that virtual reality for acrophobia, which is a fear of heights, leads to significant reductions in cognitive and behavioral symptoms with as few as 2 sessions. Virtual reality has proven itself to be quite a successful treatment for specific phobias, and with a little more work to make the situations and objects as realistic as possible, it will be able to replace exposure therapy as a top treatment.